I'm Jennifer Sinus. You're watching News 24 Live. I'm joined in studio by our in-house doctor, Dr. Darren Green, and today we're answering your social media questions. Dr. Darren.
Good morning.
Good morning to you. Now we're talking sinuses today. A lot of people are wondering about sinuses. One of our readers specifically says he's had problems with sinuses for years now, and he doesn't really know how to treat it and what to do.
A lot of people don't actually know what the sinuses are and where they're actually located. Everybody that presents with a blocked nose just says to me, and specifically in the workplace, you hear everyone saying, I've got a cold. No, I've got sinus. I'm not sinusitis, I'm known with sinus.
How do you know you have a sinus?
So I think what people need to understand is that there's a distinct difference between a normal cold, a flu, and sinusitis. And often the symptoms start off with a simple cold, which is basically a rhinorrhea, which is a runny nose, a bit of itchy eyes, tearing eyes even, at the introduction of a simple virus that is self-limiting and goes away after a few days. When you have a flu, it's a different story. Flu specifically refers to the influenza type viruses, and there are a host of them with a varying degree of severity in how they affect you systemically. But generally, when you have a bit of body aches and pains, muscle pain, joint pain, even a bit of fever that comes up and down, you know you're starting to go into a bit of a systemic flu-like illness. Sinusitis, however, refers specifically to inflammation of the sinus cavities. Now, there are quite a few in your brain, in your head, sorry. The frontal sinuses, the ethmoid sinuses, the paranasal sinuses. And what their function is basically is they basically drain a lot of the fluid, and they also moisten the membranes, as you can imagine. And the sinus cavities themselves are filled with air. The problem comes in is when you manage to get an infection or a bug, whether it be a germ that's a bacteria, a fungus, or a virus, into the sinus, that then causes excess production of mucus and slime, etc., that then causes the effects of swelling and inflammation of the membranes inside the sinus. That swelling and irritation of those membranes then leads to the pain that we get, frontal sinus headache, for example, the congestion, the pain in and around the eyes, as well as the running nose and the recurrent symptoms of a postnasal drip from all the mucus and secretions that are building up and draining down the back of your throat, for example. Now, that sinusitis, if it's not treated properly and you don't look at preventing it, if you suffer from things like allergies, for example, you could run into the complications of sinusitis, which are quite important. And one of them are orbital cellulitis, which is an infection in and around the orbit of the eye.
That sounds bad.
In the socket, you get quite a bad infection, and you could get a collection of fluid and even pus that then causes damage to the nerves of the eye, and the muscles are also involved. And then, of course, meningitis. Meningitis can occur from untreated sinusitis that becomes obviously complicated. So people don't realize that, and I think a lot of people underestimate the power of the bug if not treated sufficiently and early. Everyone wants to know, like this client, why it comes back. And that's because the triggers need to be addressed. If you suffer from allergies and hay fever and you're constantly having the symptoms of a runny nose, a blocked nose, etc., you need to look at preventing that, and that means sometimes going on to chronic medication or changing your environment, controlling the things that you can in terms of knowing the triggers for your allergies. And that means obviously diet, it means your environment, things like house dust mite, grass, weeds, etc. as well. So one certainly needs to have a bit of a broader, holistic approach to treating the simple term which we all use so easily called sinusitis.
So it sounds like sinuses could actually lead to quite a big problem if you leave it untreated, and I think a lot of people go through life leaving it untreated. Now, meningitis can be quite serious.
Indeed, that actually just involves an inflammation or a secondary infection that spreads from the sinuses to the membranes, which are like cling wrap around the brain.
Wow.
And there are three sheets or layers around the brain that form the meninges specifically. Some of them are hard, rubbery, leather-like layers, and the others are very thin. And they are rich in blood supply. So if the infection spreads via the blood and reaches those membranes and causes a cheesy layer, really a cheesy layer of pus on the surface of the brain, you can imagine how that then affects the metabolism of the brain, the blood supply of the brain, and also obviously direct effect of the infection on the brain cells themselves. And what people also don't realize is that often with sinusitis you can take treatment, feel better after taking a course of really good antibiotics for a while, using your nasal sprays and trying to flush it, but then 6 weeks later you're back where you began, and often you have little collections or pockets that are sealed off that the antibiotics can't actually penetrate inside the sinuses. Those pockets, if you think of an Aero chocolate, when you break it up and look at those little air bubbles, if you've got that in the sinus, what we call loculations, it's very difficult to actually penetrate them. So often you'll find the ear, nose and throat specialist has to do a sinus lavage, where they actually go into the sinus with a scope. That's a fiber optic device where you can see with a camera what's going on inside the sinus, and then even wash out and break down those loculations. They then take out the things that they see and send them away for tests to identify things like fungal infections that are resistant and keep coming back, for example.
Well, there you have it. Your sinuses could lead to a more serious problem. If you have any questions for our in-house doctor, Dr. Darren Green, please leave those in the comment section below and we'll be sure to get to them.